Hello everybody, I'm Dr. Amir Hamzah Abdul Latif. I'm a consultant clinical immunologist and allergist as well as a pediatrician, and one of those things that I deal with on a very daily basis is the problem of eczema. Now eczema is something sort of a taboo word for many, especially for parents but also adults, because you can get adult eczema, adult onset eczema in about up to 10% now according to the latest data, where maybe about 20 years ago it would have been just 3 to 4% prevalence amongst adult onset eczema, but now it's 10%. Now if you put it to the childhood period in children, instead of 15%, it is probably now closer to 20-30% worldwide, and I don't think here in Malaysia it has escaped that numbers. So eczema, really one needs to understand the concept though, because two things that when in my almost 20 years of practicing clinical immunology and allergy is that the thing is related to food, and because it's an inflammatory condition, one must use steroid creams all the time. So on one hand, parents avoid steroid cream as much as possible, and I think that's fine because you need to know the severity of the eczema. For very mild eczema, just a few percentage of the body surface that's involved, I wouldn't be using that too much. But when it's really inflamed and where there's gross itchiness, babies can't sleep, and hence parents cannot sleep at night in particular, early mornings around 2-3 a.m., then it upsets the whole family dynamics, and of course it plays on the quality of life of everyone. So when I talk about eczema, I always say this is a chronic disease. This is a chronic inflammatory disease. It is a chronic inflammatory skin disease. It is a chronic inflammatory skin disease that itches so much. So that are the two and three keywords. It's chronic, there's inflammation, and there's intense itchiness. So we want something obviously to take care of all those problems. And of course the other thing is eczema tends to be dry for most parts of the time unless there's a very bad flare-up, and hence there will be what people say is all gone wet. Okay, now if it is dry, obviously I always say keep it moist, right? So we know all about moisturizers. There are tons of moisturizers, emollients, in humectants in various forms, whether they be creams or in ointment forms. But is moisturizing enough? Now actually moisturizing is not just to keep the skin moist, right? It's not to overcome the dryness. A lot of studies nowadays, and this has actually come from this part of the world in Asia, to show that moisturizing can actually bring down the inflammation. So this is not a case of just getting the skin to be moist, but also to bring down the inflammation. Hence, we talk about moisturizing, but we talk about more than moisturizing nowadays. Okay? Now, if we talk about inflammation, now that's the acute flare-up of the eczema. And obviously, when that happens, almost literally hell breaks loose in a way. The child will be scratching non-stop until it bleeds, and that's a real torture for the parents to witness, right? And I've seen that happening right in front of me as well, literally with just a tiny little scratch on the skin, and the whole skin is now all blood stained. That's really traumatic, even for me, and sometimes I just sort of pause and help out and make sure that the child is comfortable. Parents are now back to feeling normal and able to discuss and talk about the children with me. So we have moisturizers, we have medications. Now, medications for me in eczema are rescue medications, in the sense that it is for inflammation really, and to handle the itchiness. Okay, but they are still medicines, they are still drugs, chemicals. So, and that would be in the form of creams or oral. Now, if it is cream, we talk about the steroid creams. Everybody knows about that, and there's a lot of phobia about steroid creams. Now, I can reassure you that if we use the steroid when 100% needed and in the right dose, it is very, very, very safe. Okay, but of course, you do need to know the potency of each steroid cream, from mild to the really more moderate and really more heavy ones, shall we say, to put it in simplistic terms. And then we have other creams in the form of antihistamine creams and also antibiotic creams. Now, in replacement of steroid creams, there are usually a type of creams called calcineurin inhibitors. The main ones that we have here in Malaysia is tacrolimus and pimecrolimus, or the brand names would be Protopic and Alidel. Okay, so they tend to be the non-steroid medication that can suppress the inflammation, but it's not without its side effects as well. And there are also clear warnings for the usage of these medications, creams. And then of course, orally, we have the antihistamines to try and ease the itchiness. And I can tell you, itchiness in eczema is so difficult to treat. And I think it is so much a problem that eczema is known as the itch that rashes. If you have an itch and it develops into a rash, it's more likely to be an eczema. And eczema that doesn't itch, you have to think of something else. Probably it's not eczema. Now, is there such a product anywhere in the market that can handle all this? Which means it, in a nutshell, from my perspective, it moisturizes and it sort of almost replaces the medications that are available, those chemical drugs. And I think we do have that in the form of Dr. Buds. And the thing about Dr. Buds is it's not just for eczema. There are, I know it was also available for acne rescue. And we always talk about the skin, maybe on the face and the whole body right up to the toes. We forget the skin is also the scalp. So they also have for two conditions that are commonly encountered, for dandruff rescue and also the hair loss rescue. Thank you very much. I'm Dr. Amir Hamzah. Thank you.